Hi and welcome. I am trying to learn medicine. Today, sickle cell anemia and after that, megaloblastic anemia. And after we've done it, we're going to do shoulder impingement training. And if you participate in the shoulder impingement training, then it's at your own risk. And we're talking about blood system, blood disease, and internal anatomy. And this is no medical advice, we're just reading about it. And that is part 2 for sickle cell anemia and megaloblastic anemia. Now, we want to do now a presentation about it, sickle cell anemia. So first we want to say what anemia in general is. It is insufficient amount of hemoglobin cells in the blood they are carrying the oxygen. And the symptoms are tiredness, shortness of breath, palpitation, insomnia, headache, and chest pain, and ankle swelling, and loss of appetite, disturbed vision, and pallor of skin. Indigestion also. Okay, we try to mention as many as possible. So basically that, and now sickle cell anemia. And that is an inherited condition. I think we should mention that overall, because iron deficiency, there was nothing written about inherited, and also not by pernicious anemia. I don't think any of the other one was inherited. Now, sickle cell anemia is inherited, and mostly people with black skin have it, almost exclusively. The symptoms start in childhood. Okay, and the symptoms start in childhood. Okay, symptoms. Slight yellow discoloration of her skin and eyeballs. Okay, slight yellow discoloration of skin and eyeballs. Feverishness, weakness, and anemia, especially after strenuous physical exercise. Okay, we're gonna say feverishness and weakness, in particular after physical exercise. That seems to be something important. That's something important. I'm going to say that. Anything causing deep or rapid breathing may result in a crisis when the symptoms are particularly severe. Anything which causes heavier breathing can result in a crisis. We're going to say, we short it down to that. I didn't understand it in the first part. Now I understand it. It's not heavy breathing or something. We mean anything heavy breathing. So also shock or something. Blood clots may occur anywhere in the body. Blood clots. And I don't really understand that part. Why does now the anemia lead to blood clots? But let's try to mention. So we're having a slightly discoloration of skin and eyeballs, feverishness, weakness after physical activities, and anything causing heavy breathing can cause a crisis. And also blood clots can form everywhere in the body. Duration. The condition is chronic, persisting throughout the patient's life. Okay, it is forever basically. It is lifelong. Causes an abnormal hemoglobin present in the blood. Hemoglobin is the red pigment in the blood which carries oxygen from the lungs to the tissues. If, because of exertion or respiratory infection, the amount of oxygen in the blood is reduced, the abnormal hemoglobin causes the blood cells to deform into sickle shape. What is the hemoglobin with the blood cells? An abnormal hemoglobin present in the blood. Hemoglobin is the red pigment in the blood. But that pigment is carrying the oxygen. The abnormal hemoglobin causes the blood cells to deform. Let's shorten it down. I don't really understand that part. The problem is that the abnormal hemoglobin, this is the safe sentence as it is, the abnormal hemoglobin causes the blood cells to deform into a sickle shape. And these cells are then attacked by the immune system of the body and destroyed, and that causes anemia because now there's too little hemoglobin. Let's see it again. No, it's hemoglobin, it's the same word. I don't get no difference. Is it hemoglobin cell? Is it the blood cell? Is it the pigment? Is it maybe both? hemoglobin is abnormal and it causes the blood cells to deform into sickle shape. Let's try to say it exactly like that. The hemoglobin is abnormal and the hemoglobins, let's make a plural out of it. If we're saying it wrong, it sounds not the right way. Someone else it. The hemoglobins, now we're taking it out. It could be better or that because we can't find it out. Causing the blood cells to deform into sickle shape. Then they are when it's taken by the blood system. Complications. Ulcers and local infections. Ulcers and local infections may occur in bones, kidneys, and other organs. The disease, maybe saying the symptoms of the disease can lead to ulcers and also local infection. Why? I don't get it. What has it to do with anemia? It can lead to ulcers and local infection in bones, kidneys, and other organs. Bones, kidneys, and other organs. And arrange for the patient to have regular blood transfusions if sickle cell anemia is diagnosed. This is the only form of treatment available. There is no way of preventing the disease, but avoiding strenuous physical activity may reduce the risk of severe crisis occurring. Complications arising from the anemia may result in death at any age, but many sufferers survive beyond middle age. Okay, we're going to say to the last part. Physical activity, avoiding physical activities, avoiding can help to avoid crisis. Regularly, blood transfusions can help and is the only form of treatment. It is lifelong. It is not preventable. Avoiding strenuous activities is the only way to reduce the risk, and crisis can lead to death. But okay, I think we have it all together. The symptoms of sickle cell anemia itself were also that it was this slight yellow discoloration of skin and eyeballs, feverishness, weakness after physical activities. Any form of rapid breathing can cause a crisis, and anything causing rapid breathing cannot cause a crisis. Anything causing deep or rapid breathing, and blood clots may occur anywhere in the body. Let's try it. It's pretty complicated. It's not written coherent in one show. Sickle cell anemia. By anemia in general, there is too little amount of the hemoglobin which is carrying the oxygen through the body. And the symptoms of that are weakness and shortness of breath and disturbed vision and palpitation and pallor of skin and ankle swelling and chest pain and lack of appetite and indigestion and headache and insomnia. Now, by sickle cell anemia, that is an inherited form of anemia. So sickle cell anemia is inherited, and it is almost exclusively in people who have black skin color. And it appears oftentimes starting from childhood on, and it is lifelong. And now the problem there is that the hemoglobin is abnormal, and that causes when the blood cells, if they are under stress, if someone is breathing heavily, to deform. So the hemoglobin is abnormal, and that causes the blood cells to form two sickle shapes. And they are then attacked by the immune system and destroyed. Now, it can happen through any type of thing which causes heavy breathing. Physical activity can cause a crisis. Another symptom is also slightly discoloring in yellow of eyeballs and of the skin. And blood clots can form over the body. And if a crisis comes, which can happen for anything which causes heavy breathing, then ulcers and local infection can happen anywhere and death. It is lifelong. There is a treatment, and this is the only form of treatment, that are blood transfusions. And That is according to Keith Watkins' Family Medical Advisor book, page 72 and 73, but this is no medical advice. I think it's good one to things, but I don't think it matters. I don't think it matters. I said anything before, and I haven't even found anything which I missed. So I'm going to stop the camera, and we needed a little longer time than I thought. That means we're not going to do this time the folic acid anemia, the megaloblastic anemia, or whatever it was. We're going to do this the next time. If you're here for medicine, you can go directly to the next part where we're going to do this folic acid thing. If you are here for short impingement training, we are going to do it now. But if you participate in the short impingement training, this is the low risk. Good and stable stance, and we do shoulder circles. We're going back with the shoulders, up and front and down. And again backwards and front, up, back, and down. And now, long arms, strong fists. Go as far back as you can with the shoulders. High up with the shoulders, then front and down. Again back, up, front and down. And high up, back, down, front, up, back, and down. And now, the both of the long arms, strong fists, shoulders down and together, and turn the arms to the inside. So, shoulders down, together, arms to the inside, with it. Arms to the outside, shoulders down, hands together. Arms to the inside, shoulders down, hands together. Arms to the outside, shoulders down, hands together. And the next exercise, arms to the side, a bit in front, arms in front, shoulders down and together. Arms back, shoulders up and in front. And arms in front, shoulders down and together. Arms back, shoulders up and in front. And release. And the next exercise, just lift the arms up. And shoulders up. And release out down. Again, the arms up. Shoulders up. And pull down. Another time, arms up. If this or any other exercise causes pain, we'll now do it. Arms up. And down. And now the pretzel curl, arms together. Bring them down and to the outside. And press something. You can use a sock or something else, have the longer to the outside, let it fall down, and try to get it again. And on the other side. And now stretching the elephant trunk. Bring the arm in front, the shoulders back and down, pull the arm in, have the fingers, try to relax the arm. Go with back with the shoulder and turn the palm up to the sky. And the other arm in front. Shoulders back and down. Pull the arm in, have the fingers, try to relax the arm. Go with back with the shoulder, turn the palm up to the sky. And that was the short impingement training. I thank you very much, and until next time.